Welcome to another segment of Under the Microscope. I'm Jeff Gold, and thank you so much for being with us today. I had the pleasure of being joined by Dr. Steve Wengel, our chair of the Department of Psychiatry in the College of Medicine, and a new member of our team, Dr. Jennifer Yalof, who serves as our assistant professor of psychiatry and UNMC's new campus wellness coordinator. Welcome, and thank you so much for being with us today.
Good morning.
Thank you.
Steve, do you mind telling our audience a little bit about why this wellness program is so important and why the Department of Psychiatry has taken a lead on this?
Well, I've been interested in wellness and well-being for quite a few years as a psychiatrist, but I've been reviewing the literature lately, and healthcare training is really stressful. Stress is ubiquitous in life anyway, but certainly in healthcare and healthcare training, it's a problem. 11% of U.S. medical students think about suicide in a given year. 11%, 1 out of 10. 50% of U.S. medical students, according to Dr. Derby at the Mayo Clinic, experience symptoms of burnout during their training, during their 4 years of medical school training. It's a problem, and we want to help with that problem.
Well, it's so good that you've done this. I know that Dr. Sebastian is planning a series of seminars in January, and Lottie Derby is actually going to be joining us as one of our guest speakers, and of course she is a nationally regarded expert. Well, welcome, and thank you so much for being with our audience, but more importantly, thank you for joining the team. And why don't you tell us a little bit about your background?
So I'm trained as a clinical psychologist. I guess a vision that I see for this program that links in with the training that I've done is really increasing awareness of mental health services that we can provide, self-care tools that we can provide, stress reduction, overall wanting to reduce chronic stress that individuals might be experiencing, as well as really facilitating resilience in the population that we're going to be working with. So when I was doing therapy with clients, I saw a variety of individuals throughout my training. But I worked with providers and individuals who are in training, and they were under extreme amounts of stress, and they were cognizant that if they were under stressed, that might impact how they worked with their patients. So I really developed a passion and an interest in doing outreach for this population, especially those who might not seek out traditional resources, such as going to therapy. I think that outreach and education is a way to target those who might not typically seek out those resources. And something that was really emphasized for me, while I was doing therapy and just in general, is cultural sensitivity and just being really aware of diversity issues on campus. So I think moving forward with this initiative, that's going to be really important in implementing any programs that we do.
Well, it fits so perfectly with a lot of our initiatives now. We're very focused on wellness and mental health of our students and staff and our faculty. We're very focused on diversity and inclusivity and rooting out biases that have been a part of the history of higher education, particularly in the health professions. And so your coming on board is really important. Let me ask both of you just for a second about your thoughts about destigmatizing the mental health issues, the stress and the burnout that is also ubiquitous. Unfortunately, having children that have recently gone through both undergraduate and graduate education, there's always stress associated with exam cycles and social events and things like that. So how do we destigmatize that?
I think I've done training at a number of college counseling centers where individuals wouldn't seek out services because of stigma, and it can be stigma in their career orientation or stigma with their cultural background. And I really have come away from that feeling like there is hope. I think that people I've been working with have really become aware of what's going on. There are so many studies that are out. And there's also great things already going on UNMC's campus that I'm aware of. So I think one of the first things I'm going to be doing is just cataloging what's going on. I also want to assess the needs of the individuals that we're going to be working with. So that could include doing surveys, small focus groups, really getting a pulse of the campus, and then moving forward doing interventions and implementing programs with individuals who are interested in collaborating and various stakeholders. So these are all ideas that I've come up with while working in different centers where I felt like people were really interested in enhancing overall well-being. And what we're really going to be utilizing, and we've talked about this a bit, is best practices for self-care, so best practices for stress reduction, and I really think that will help reduce stigma, because we're not just going about this without looking at research. We're going to be doing, empirically validated techniques.
Great. Well, that's really exciting, and I think that's a really important part of what we're doing. So how would our students or our faculty or others get more information about this program, Steve?
Well, we'll be rolling out a lot of initiatives here in the near future. We plan to meet with the deans of the colleges because, again, this is a campus-wide initiative. We'll be doing a rather large kind of PR focus here in the next month or so.
Web page, social media, perhaps even more of these little video segments.
Absolutely.
Absolutely.
Yeah.
Great. Well, thank you so much for being with us today. And thank you for being with us today on this segment of Under the Microscope.